I'm Naomi. I'm a working mom, raising a family in Toronto with my partner. My journey to Women's College Hospital began a couple months after my second child had been born, when I realized that postpartum depression and anxiety had dug its claws into me. It wasn't until another mom saw me crying and disheveled in the school playground, and she insisted that I go and see my GP and get screened for depression and anxiety. I feel like the stigma of mental illness was one of the biggest barriers that I faced, and I felt very alone and isolated and fearful that if I admitted how bad I was feeling, that my children would be taken away from me. One of the truly valuable feelings that I had when I came here was that all of the staff truly understood what I was going through, and that the feeling of impending doom was not something that was going to last a lifetime, but that would pass and that I would start to feel better soon. Stella's playroom was an absolute gift. I was able to drop my baby off and go and meet with my social worker, and I knew he was in really great hands, and it helped to alleviate the guilt that I felt from leaving him at all with anyone, and so it allowed me the time and the space to take care of myself.
My name is Kaylee McDonald. I'm a social worker therapist with the Reproductive Life Stages program in the Women's Mental Health at Women's College Hospital. The Reproductive Life Stages program sees women and their families in various stages related to pregnancy and postpartum. One of the main barriers that patients we see face is that their struggle is often invisible. So if care providers or family or friends don't know the right questions to ask, they can often see a woman as seeming fine, looking like she has it all together, when in fact she's struggling with very severe depression or anxiety symptoms and not feeling at all well inside. Though we see primarily women in our program, the work that they're doing to address their mental health is in fact helping and benefiting their children, their partners, their families. And so we also see couples together in couples therapy and sometimes for individual consultation in order to meet the needs of the whole family. One of the other services that we have as part of our program to help people access care here is Stella's Playroom. And this allows people to leave older children in childcare so that they can attend their appointments, and in fact in therapy helps new parents who are anxious about leaving their babies at daycare to get used to and comfortable with trying out childcare experience and then working in therapy on managing their anxiety symptoms. I love the work that I do as a social worker therapist with Reproductive Life Stages program. I'm so grateful to the clients, the patients, families that I have an opportunity to work with. Seen a tremendous amount of courage and commitment in the folks that come for therapy in order to address their mental health.
I remember one of the things that Kaylee said to me to help me kind of just celebrate and focus on one thing at a time every day. And she just said, focus on socks. One sock, okay. Next sock, all right, let's move on. And just the simple task of getting dressed and getting out of the house was a challenge at that time. And that was so incredibly helpful that she gave me the permission to just focus on those simple things. I'm so much better now. I'm back to my old self. I'm back to work. I'm enjoying my children immensely. And I have a huge sense of gratitude for all the people that I met here at Women's College. When you're used to being the one who takes care of everyone else, and someone gives you permission to take care of your own well-being, it's enough to put you on the road to recovery.